This introduction to medical terminology explains what Greek and Latin roots and affixes are, and why they matter so much in medical terminology. It also establishes the key points which will separately be addressed throughout the following chapters. As a standard definition, medical terminology is a specialized area of technical vocabulary used to describe the human body, its conditions and diseases, and the processes and procedures associated with the diagnosis, care, and treatment of patients. Based on this definition, this introduction provides an overview of the different word parts and how to identify the meaning of common Greek and Latin roots and affixes that are found in medical terminology, and associate them with their relevant medical specialties. The singular and plural forms of medical terms will also be addressed. So, by the end of this section, you will be able to differentiate between the different word parts that compose the medical term, which are the word roots and affixes, to relate Latin and Greek roots to relevant parts of the human body, and to use a dissection technique to divide and define medical terms, and finally, to identify the singular and plural forms of medical terms and how they work. There is a common belief that medical terminology is used only in hospitals and is the exclusive preserve of healthcare professionals. However, this is not the case. We are all exposed to these terms, whether in the doctor's office, talking with friends, reading the newspaper, or watching TV. Most importantly, medical terminology is mainly about our body that we see, feel, and touch every day. Therefore, everyone has something to gain from learning how to understand and use medical terminology, whether in our professional or personal life. At first glance, medical terms may appear intimidating and difficult to grasp for many reasons. For example, because there are so many medical terms, or each medical specialty has its own terminology, or many may say that many Latin and Greek terms are long, complex, and hard to understand, even for native English speakers. However, once you understand the standard structure of medical words and the definitions of some common word elements, believe me, the meaning of thousands of medical terms will easily be unlocked. To make it easy for learners of medical terminology, 3 common types of medical terms are raised here. The first one is words built from Greek and Latin word parts, such as ophthalmology and cardiology. The second is words used in modern English like CT scan and pacemaker. The third is words created from a person's name. They are called eponyms, for example, Crohn's disease or Hirschsprung's disease. In this course, however, we will mainly be focusing on the first type, which is the words of Latin and Greek origins, because they are the backbone of medical terminology, and they make up to 75% of total medical terminology. We will dissect them and clarify their word roots, prefixes, and suffixes. In addition, We will also address the other two types of medical terminology in this section of medical specialties. Now let's start with the word root. The word root is a word part that is the core of the medical term and contains its fundamental meaning. The root of a medical term is usually a body part. Let's check these examples. Colostomy. Can you guess what is the word root in this example? It's col, which means colon. Let's see another example. What can be the word root here? It is arche, which means testicle. Let's have a look on the following examples, which will clarify more the meaning of word roots. As you can see from the table before you right now, cardi means heart, hepat means liver, colon. This confirms that the word root is usually a body part, as you can see. Take a moment and check the other examples and try to visually link them with this photo of some body organs. Let's now move to the part of suffixes. Suffixes are word parts that are located at the end of words. They can add meaning by indicating a condition, procedure, disorder or disease. Their meaning don't change from word to word. They are invariable. This table is the best example of how suffixes work. As we can see, each suffix has a fixed meaning and determines the action, status or quality of the word root. As you can see from the table in front of you right now, pathy is a suffix which means disease. When you add it to a word root, which is retina, it becomes retina disease. Another example, itis means inflammation. Added to the word root hepat, it becomes liver inflammation. Ectomy is a suffix, means surgical removal. If you add it to tonsil, which is a word root, it becomes tonsillectomy, which means surgical removal of tonsils. Algia as well means pain. Added to word root, which is meaning muscle, myalgia means muscle pain. The same thing applies to the suffixes plasty and gram. But don't worry, immediately after this chapter, we will have another chapter dedicated to suffixes and only suffixes, where we will highlight all types of suffixes. And like suffixes, prefixes are word parts that are located at the beginning of a medical term. They often indicate information such as abnormal conditions, numbers, positions, or times. And most of them are used in everyday language. This table, like the previous one of suffixes, it highlights some examples of prefixes and shows them while they are in use. Let's read over this table. The prefix by means to. If you add it to the word lateral, it becomes bilateral, which means two sides, like bilateral orthopexy. Uni means one. If you add it to the word lateral as well, it becomes unilateral, which means one side. Let's go to the third example. We find post, which means after. For example, post-surgical appointment, which is the appointment that the patient gets with the physician after the patient has had a surgery. Sub means below or underneath. The example we have in the table is subcutaneous, which means underneath the skin. Inter means between. Added to costal, which refers to pertaining to ribs, it becomes intercostal, meaning between ribs. Tachy means fast. When used in this medical term cardia, the medical term now means fast heartbeat. Again, don't worry, this is just an initiation. We will have a detailed chapter on all types of prefixes. Let's talk now about the combining vowel O in medical terminology. The combining vowel is used for mainly two reasons. First, to connect word parts, and second, to make medical terms easier to spell and pronounce. More explicitly, combining vowel, which is O in medical terms, is used before suffixes that begin with a consonant and before another word root. It is always said that explaining with examples does the job. So in rhinoplasty, you notice that the combining vowel, which is O, is added because the suffix plasty starts with a consonant P. Hence, the rule says that a combining vowel is always used before suffixes that begin with a consonant. Keep it in mind. In the second example, osteoarthritis, as you can see, the combining vowel is added between oste and arthur. As a result, and as a rule, the combining vowel is always used before another word root, even if the second word root, art in this case, starts with a vowel. For the sake of more clarification on this part, this table is complementary to the previous one. In the first example, arthritis, the combining vowel shouldn't be there because the rule says that never use a combining vowel before a suffix that begins with a vowel. The second example should have a combining vowel between the two word roots because, as it was emphasized earlier, a combining vowel is always inserted between two word roots, no matter what letter the second word root begins with, either consonant or vowel. Having done with identifying the word parts morphologically or mechanically, let's now learn some techniques on how to semantically understand them. Three main steps are highlighted here. Firstly, always try to divide the medical term into its word parts. And secondly, define each word part in this order: suffix, prefix, and then the word root. Thirdly and finally, put the meaning of the individual word parts together. For example, let's apply these techniques and follow these steps to define the term polyarteritis. We start by dividing the medical term into its word parts. Then, we define each word part applying the following order: suffix, prefix, and then word root. So, starting with the suffix, itis means inflammation. Then, the prefix, poly, refers to many. And finally, the word root, arter, means artery. In the end, when we put them together, the job is done. So, inflammation of many arteries. I love examples because they are very effective when it comes to consolidate understanding. But this time is for you. Take a moment to define osteomalacia, following the same steps we've just seen. Yes, I'm pretty sure you did well and you followed the same steps. You divided the medical term into word parts, and you defined each word part separately following the order we saw before. Then you came up with this meaning, which is softening of bone, isn't it? Here is a third example to help you grasp the meaning of how medical terms work. In this example, colorectal contains two word roots. However, the same rule still applies or always applies. We divide this term first, then we look for the suffix. It is all in this example, meaning pertaining or related to. Afterwards, we'll look for the prefix if any. It's not there. And finally, we'll look for the word root. In this example, we have two. It is okay, don't panic. We start with the first, which is the colon, then the second, which is the rectum. When we put them together, we come up with pertaining or related to colon and rectum. I believe that things are getting easier now. So now let's move to the last part of this introduction. It is about singular and plural forms of medical terms. The singular and plural forms in medical terms are quite different from the ones that are used in the standard language. They have special characteristics that should be practiced and memorized. But don't worry. We will list them all here and make them appear so easy to remember, and they will be easy to remember. As you can see from the table before you, if a singular word ends with A, just add E to make it plural. Like the example we have, vertebra becomes vertebrae or vertebrae. Okay, look at this different example. If a word ends with X or X in its singular form, just drop X or X and add ices. For example, appendix becomes appendices. In the third example, when X is in the end, replaced with G's. For example, phalanx turns into phalanges. As last example in this table, on transforms into a. The most famous example is criterion, which becomes criteria in the plural form. Here are the other characteristics of how the singular and plural forms work. If a singular word ending with drop and add a to make it plural. For example, ovum becomes ova. And if a singular word ending with as, drop us and add I, like alveolus becomes alveoli. If a singular word ends with ma, just add ta. For example, sarcoma becomes sarcomata. Finally, when a singular word ending with y, just drop y and add es. For example, ovary turns into ovaries in the plural form. Trust me, if you memorize this table and the previous one, be sure that you can consider yourself done with the singular and plural forms. Just with little practice, you will hone your ability to turn singular medical terms into plural ones with ease. See you soon in the next chapter.